Medical Minds Beyond the Whiteboard. Today, we have Dr. Lav Kochgaway as our esteemed guest. Dr. Kochgaway is the founder and the executive director of Netralayam, a super specialty eye hospital in Kolkata. He has almost 22 years of experience in the field of ophthalmology, starting his career as an assistant director at Sankara Nethralaya. He has been honored and awarded many times for his videos and posters at national and international level. Some of them are the grand prize for overall best video at the annual conference of Asia Pacific Association of Cataract and Refractive Surgeons in Jaipur, the best video at the renowned Challenging Cases Symposium at ESCRS London. Though Dr. Kochgaway is very proficient in all types of ophthalmological surgeries, his areas of expertise are adult and pediatric cataract, squint, ocular trauma, and LASIK. And he has performed more than 10,000 complicated surgeries and is considered one of the best cataract surgeons in the country. Welcome to Medical Minds, Dr. Lav.
Thank you. Thank you so much.
To Netralayam, it's been quite a journey. You did your fellowship in pediatric ophthalmology at the prestigious Sankara Nethralaya, Chennai, where you trained under the great teachers of ophthalmology like Dr. T.S. Surendran, right?
Yeah.
So, what was that experience like?
I think that was a turning point of my life. Actually, it was a turning point. Before that, almost I joined medicine in 93. And this was 2003. So 10 years of grueling course, then post-graduation. Frustration was at its peak because and then I got this opportunity, and after that there was no looking back, because the career took off very well after this. And it is a very interesting story. I was down with, and I was so frustrated that I had planned to go to US. I had taken admission there, my visa, ticket, everything was ready. And then I had some health problem. I had an electric current in my finger, and that didn't heal for 3-4 months.
Oh.
And finally, I gave up because my departure date was coming close and this was not healing. I got my ticket cancelled. I informed the university that I'm not joining. And within 3 days, it healed after.
Really? That's miraculous.
And then I was in the dark what to do now, because my plan was something different. And that I gave up due to this health problem. Then a week later, I got a call from Sankara Nethralaya that, doctor, you had applied for a fellowship 2 years back. In my PG days, I used to correspond with them that what is the criteria for fellowship and other things. So are you interested in coming for a test and interview? And that showed me light at the end of the tunnel, that I have finally something is there to look forward to. And then I went for the test, qualified in the test, then interview. And luckily, or coincidentally, interview was being taken by my guide only, Dr. T.S. Surendran.
Oh, so he knew about you.
He asked me that after the initial whatever questions they had to ask, clinical questions, then he asked me, what specialty do you want? I told him pediatric ophthalmology. Okay, then he told, Acha, suppose we are not able to give you pediatric ophthalmology, then what will you take? I told, sir, I have not thought of any second specialty.
Wow. So
I actually had not thought. So I started thinking what to tell. Then I just told him, sir, just for filling it, you can write general ophthalmology. I don't know. I have not thought of any other specialty. So he wrote. Then I got a call maybe another week later that you have been qualified. And that was such a relief. And then I joined in October 2003. And in January, again, within 2 months of my fellowship, Dr. Surendran called me to his office again. That was a training period. We were fellows. That is 1 year fellowship. So he called me that there is an opening in Calcutta. Would you join after? Would you like to join there after the fellowship? I didn't ask my parents. I didn't discuss with anyone. I just there only I told him, yes, sir, I'll join. He was very happy. Then all my training, everything got expedited, and I landed in Calcutta in 2004. That is the, in short,
Your story.
that 10-year period.
So you were the first candidate to join the
Yes,
reputed Shankar
yes.
Nethralaya-Orbis Pediatric.
That is being quoted even today. Just last month, I sent some donation for upkeep of the pediatric ophthalmology department in Shankar Nethralaya. Everyone remembered, they told that he was our first fellow. So that is a record which cannot be broken.
Yes, of course. So you said you were on another career trajectory. So was it like, are you a doctor by choice, or was it a conscious career choice, or were you forced into this career?
No, that is another interesting story. Because till my 10th result, I have not even thought of becoming a doctor. Till my 10th result, I was always very fond of maths. I wanted to go to engineering. But as you, one of my father and my uncle, they were very fond of someone becoming a doctor in the family. So after my 10th result, they sat with me that you take both the subjects, try, see if you can manage. Just to please them, I took biology.
So
And then I could not manage
parents
biology
and
and maths.
family.
I could not manage both biology and maths, and slowly shifted towards biology because that was a compulsory subject. Maths was optional.
Okay.
So I had to clear that. And then I landed up with in medical. But believe me, not even for a day I regretted. Even during the long MBBS days, and then PG, then fellowship, not even once thought came into my mind that I've landed up in a wrong profession. So that was a blessing in disguise. Sometimes you should yes, you should listen to your elders.
Maybe. Yeah. So, I mean, ophthalmology. So what is the one thing that people must know? Like they call in India, especially, ophthalmology is not a word. Oh, aankh ka doctor, eye surgeon, yeah, Netralaya, Netralayam. So this is what goes by. So what is one thing? I mean, like sight is so important for all of us.
Yes. See, again, and why it is most satisfying that once you treat a patient with a decreased vision, so I would say more specifically for ophthalmology, it is actually vision. And my specialty again is, so apart from being a cataract and refractive surgeon, my super specialty is pediatric ophthalmology. That again is so satisfying, that because you are making so much of difference in lives of, so eventually one word it will come to my mind is happiness with good vision, what we give to our patients.
But there must be many challenges in your specialty.
Yes. Especially pediatric ophthalmology. See, these children, they don't respond. They don't cooperate with vision assessment. After giving the drops, they start howling, crying. And then you have to calm them. Then again, check their eyes. So it is quite challenging in that terms. But again, with practice over a long years of practice, now it has become a routine.
But we see more and more children are wearing glasses nowadays, right?
Yeah, yes. That is again important thing is too much of digital devices, too much of getting glued to their screens. Education also, it has become quite grueling. What data shows is too much of near activity may lead to minus powers. But again, this we cannot tell children not to study based on this data. So at least the digital screen time can be reduced. Another important data that has come is that children of rural area have less minus power as compared to children of
So,
urban
I mean,
area.
like it is proved that screen time is bad, right?
That proves. And second important thing is the children of rural area play in the sunlight. That is another factor which leads to decrease rate of myopia progression. So less screen time, less near activity, and outdoor games. That actually helps in reducing the myopia progression, the minus power progression.
So you deal with kids all the time. I mean, like, there must be a challenge. Can you share one of your experiences where you were really impressed by what a child asked for, how they behaved or what they did?
Quite a few. One thing what I've noticed, children with Down syndrome are very affectionate.
Okay.
When they come to your clinic, always smiling, they will get eye check. Then one of my patient with Down syndrome, every time he comes, then after checkup, he will show his back of his hand, and then I make a smiley. He wants a smiley to be
Oh,
made
right.
by.
Oh, how nice.
And then he goes, actually, children are a big stress buster in your clinic, because when they come, the way they react, you feel so good about them. There is another child I operated at 1 year of age, less than 1 year of age. I did a cataract. Then after 2 years, I implanted a lens in the eye. So 4 surgeries I've done for that child. That child now is in his teenage, 6 normal vision. See what difference it makes if you treat them at a proper time. And he's so cheerful, so intelligent. Every time he will come, he will narrate a poem to me. Whatever he has learned in the last between the last 2 visits, he will share with me. Some of the children bring handmade cards once they come to the clinic. I write in the note in my EMR that this child gave me a handmade card so that I don't forget next time. So these are very satisfying part of what we do.
So since you specialize in pediatric ophthalmology, I have a question. Like you were talking about a patient earlier who you operated at a very young age. So how can parents detect like symptoms like these when it happens? So how did this person know? I mean, the child was very young. So how did they know like the child was not responding?
First 3 months anyway. If one thing is, if cataract is absolutely white, it will be obvious, then parents will notice immediately.
So kids are inborn with cataract.
Yeah,
So that is a possibility.
Many kids are born with cataract. And when the cataract is less dense, then maybe few months down the line, parents notice that child is not responding to visual stimulus. Then they may bring. Sometimes, but as a rule, every child should have an eye checkup by 3 years of age. This message has not percolated deep in our society, and that leads to a lot of children who are missed out. Okay. Many will come later, maybe around 5 years, 6 years, and that as the time progresses, the chances of recovery decreases. Time is a very important factor in these children. So that we, even in our ophthalmic society, everywhere we have been telling multiple times. Some campaigns are being done by our society, but still a long way to go.
Yeah, it's still a long
way.
School
screening in India is not a.
I've never heard of kids below 3. I know like there are camps in schools, but those are for the age of 7.
Western countries, before admission in school, they have a school eye screening, compulsory eye screening. We don't have that. We don't have that. So many things are missed in that.
So you suggest like before 3 years, parents should take their, I mean, how do you handle
latest by 3 years?
How do you test how do you test their eyesight? I'm very curious about it. Like they can't take ABCD, so.
May not. See, if we do, child may not, we will just see whether the child is seeing the torchlight or not. If the child is verbal, we'll show some symbols to them and tell the child to respond whether what is this. Sometimes like a square or a house, some symbols will show. They may, if they are verbal, they may respond to that. But even if they don't respond, we do a independent eye checkup, which includes their glass power, includes their structures of the eye, retina checkup. Everything is done. Fixation is normal. So then we can confidently tell that everything is normal in the child, even though they are not reading anything. So there are many ways in which we can assess in pre-verbal children also of any eye problem is there or not.
So now we have had enough of this serious stuff. Let's go to the fun side where we talk about you being human. So I'll ask you a set of 5, 6 questions and you have to respond fast within a few seconds, okay?
Yeah.
So the one thing that you can change in the current setup?
In our hospital setup,
Both?
I would I would say that I would like to give a large waiting area to my patients, which is not there.
Wow. And maybe more
And
facilities to them too.
yes.
The one thing that you would love to do if you had more free time?
One thing this is a very important thing. As doctors, what happens that we have to be always present at our workplace, and we are not able to take too much of leave, long holidays,
Yeah.
family times. Many functions I've missed. I've gone for a day and then come back. That I would definitely like to change. Like
So do you think
spending time with
there
family,
ever be
friends.
a stage where you can do that?
That we have to decide to cut our work at some point of time. Right now, doesn't seem to be
Doesn't
possible.
seem possible, because my father was a doctor, and I think like he too was in the same frame as you are, like shortening the period of visits and things like that. So it's still
And what
going on
happens?
generation after generation.
Suppose I take 10 days leave. Then next 15 days becomes so torturous, like so many patients waiting, and
Yes.
you cannot say no, and it becomes so hectic. So it's always better to then next time you feel that better to cut down and
That's very
take care of.
interesting. I remember my father used to say the same thing. He said, when I come back, there's too many patients and they've been missed out on too many things. So the one thing that you do currently in your free time, I suppose you have some free time, what do you do?
I read a lot of biographies of very successful people, what they have done, what thing.
So
I see a lot of videos of
Oh.
that is the area of my interest, especially different models. Even in a hospitals, different models, different business models, other things. I keep on one more thing I would say, that how this influences your life. I was in a salaried job earlier with Nethralaya, and then I was just in a bookstore going through a few pages of Narayan Murthy's autobiography probably, and there he had written that something he had mentioned about surgeons. The surgeons do very well in life. They something he had written about wealth generation. Like it is very important for people to generate wealth because we are a developing world. And there he mentioned surgeon also. That clicked my mind. Why should I be in a salaried job and why not try to explore something extra also for myself? So these things, if you keep on following great people, you get one more incidence, I would say. I was listening to Jack Ma, the Chinese entrepreneur.
Yeah.
So he said,
right?
he said that till 30s, in your 30s, you should work in a small corporation, because if you are working in a very large corporation, you are just a small employee there. But if you are working in a small corporation, then you are interacting with the top management of that corporation, and then you know how they think, how they decide, with their decision making capability. All that you can imbibe in yourself, and by 40 you should be on yourself. That is what he said that time. That I correlated. Like I joined in a smaller setup of Nethralaya, which was Calcutta. Chennai was the biggest
it
one.
just launched in Calcutta, right?
So Calcutta was just 1 year old when I joined.
Yeah.
And that time, from first year onwards, I was interacting with Dr. Badrinath, who was founder of Nethralaya. Dr. Devi Shetty, I was interacting daily, almost monthly basis. He used to, because it was a joint venture between both of them. So we were interacting with them face to face on monthly basis. So that made such a huge difference, that 2-3 years, that
those people are like
then you more bored to decide.
rock stars.
These are something, if you keep on reading and hearing, then you pick up these small points.
So you suggest like reading? Yeah, I agree.
Everyone has their area of interest, so they can read about whatever they are interested in.
So what inspires you most then in such circumstances? I know like you launched Netralayam at a very young age. You've just taken over another organization right now. So what inspires you to keep moving, keep being motivated?
Most important thing that inspires me personally is teamwork. If your team is excited about what you're doing, and if there are no conflicts between your team members, that actually inspires me to do something better, something bigger beyond that. So, and I think that would be true for any organization. If your team is intact and happy and motivated, then you can achieve a lot. So till now, I would say this is the deciding factor, and sometimes circumstances of life. Many things in our career has not been planned. It is the circumstances to which we kept reacting, and then we reached here.
So you're so busy. Where do you leave your mobile phone at night? Is it? Can patients reach you?
Edit and delete it after I tell you. I keep it in my bedside only, and I have a habit of watching some video. I keep watching the video and doze off and sleep. But I keep it in vibration mode. And sometimes I've missed on some emergency calls in the night due to that.
So, but you do have a system at the hospital where you can be reached at the hospital, right?
Yes. Yeah, once they don't reach my number, then they can contact the other number.
And what's the first thing that you do in the morning?
Nowadays I get up at 6 o'clock in the morning. 1 hour I do yoga.
Wow! So you're the healthy doctor.
That has actually that I was doing earlier also. And but during lockdown, everything went haywire. All these things stopped. So I've restarted it for a few months, and actually it makes a difference. You don't realize the importance of it, but once you have been doing it regularly, then you know what you were missing.
So now we come to the next section, the future. So I have one question to ask you. Like you told us, like your parents sat down and talked to you into becoming a doctor, right? Your family and parents. So many parents are right now very apprehensive about sending their children to medical school. In fact, I know someone who the child wanted to become a doctor. The parents said, no, it's like a long process and the expenses are too much. What would you say to those parents?
One doctor in a family, just one doctor, makes such a huge difference to that family and that community, his or her own friend circle. I'll tell you from my experience. Anyway, I've been always involved in everyone's things. I keep advising people. But one incident that made me being a doctor worth was when my mother got a burn injury, and I had just reached Patna that time, and she was there. I landed half an hour early, and while I was on the way home, I got the news that she had an accident, and she had almost 50% third-degree burn. If I was not a doctor, she would not have been alive, because first I had worked just 15 days during my internship in the burn ward. But that training of 15 days, and in burn patient, first 48 hours is very, very crucial. So if that fluid replacement is not done, and if I was not aware of it, any non-medical person would have not realized, and anyway, it was a very bad prognosis situation. So they would have left it to fate and would not have realized that something happened because initial care was not there. So this just one episode, I would say, it is worth all the pain you take for 10 years during your training, or 10 or maybe 12 years also. That 12 years, and no one will be a better example than me. I have a twin brother who is an engineer. Both of us got into professional college. He went into engineering. I went into medical in 93. 97, he got his first job. 98, he went to US.
Mhm.
And when I started earning in 2004,
Mhm.
he is half of his security part, financially, everything was done. But still, that was in 2004. Now, when I see in 2022, I
Mhm.
think all that pain was worth it.
Was worth it. So it's a
Don't
long,
compare
long innings.
yourself. It's satisfaction you get with this job, you will not get anywhere. So no point getting, and take it one day at a time. Why do you want to see you have to read for 10 years, 12 years? Once you get into the medical college, you don't even realize how time passes. You have spent 10 years, but you will not even realize what has happened because you are so engrossed in what you're doing. It is worth. I always encourage people to join this profession because don't fear that is years. And then what will happen when other professions are retiring at 60, you are at peak.
So that's
And
the
you have 10 more
biggest
years to go.
advantage. Yes, you have all those years of experience plus the new technology
Uh,
that is coming in.
if health is by your side, you can very easily work at your peak capacity till 70.
Right.
So what you have lost in those 10 years, though it is not a loss, if you think it is a loss, you make it much more when you are in later phase of life.
Yeah, you said you can contribute to the community,
Respect
or
you get in
family,
the society.
the well-being.
Respect. Like my son wants to become a doctor. I
Mhm.
asked him why. So see, young children, they don't know all the depth and these philosophical things, they will not know. He just tells that when my friends and my colleagues, whatever, when they hear that my father is a doctor, they give a lot of respect to me.
Oh,
Just think
nice.
of it from a young child's perspective. So that is what society gives you. You get a lot of respect just by the virtue that you are a doctor. These are very important things.
You're very right. So nice. So young
So any
parents are
child
very-
wanting to become a doctor
Mhm.
must be encouraged.
So even if they have, so one of the things like we have in this Indian system is like, once you are into this medical, you are just, even if you don't like it, you have to do it. Like engineering, there's an option, what the parents think. You can become, you don't like it, it's not for
Even
long.
medical is there. I'll give you an example of that also. I had a classmate in MBBS and very close friend. After MBBS, he didn't do anything. He just joined first he joined Giant TV. Giant TV channel.
You don't expect that from a doctor.
And then he switched his second job. He switched into a life sciences company, which is called Indigene. And right, he's based in Bangalore and stayed there itself right from just after MBBS. 1 year with Gen TV and then Indigene. And now he is at the top. So it's not that you don't have job opportunities after MBBS. You can always change if you don't like. It's not like that.
Yeah,
You
but
have
the
to
parents
continue with
think
this.
that they made so much. Actually, becoming a doctor has become very expensive over the
Yeah,
years.
that is one thing that should be taken.
That is the reason I think
Very,
parents discourage.
very costly.
Yeah.
But even in government colleges, you have a lot of options now because almost every district has a medical college. Unfortunately, quality wise, a lot has improvement is required. Sometimes children will get very frustrated in that.
Yeah, probably the students
They
will.
don't land up in the better government colleges.
Yeah, if you don't land. Plus, I know like a lot of female students cannot stay at such places and in such districts, so they get those parents get discouraged and they discourage their daughters from becoming a doctor.
That is one thing. If you see Dr. Devi Shetty's interview, he has very clearly said that in India, medical education has become elitist.
Yeah.
It should not be. It should go to, and the cost of medical education should come down, and it should, and that also yes, road. That why do you need an infrastructure of 500 crores, 600 crores to set up a medical college? Medical college can be set with the classroom only, and these children can be attached to any hospital for training. why do we need to create so much of infrastructure to, and that is why
And
it
he's
has
so
become like
right.
this.
Yeah, there's so many
So
hospitals
that
and clinics who
needs
will
to.
happily take those students.
Hmm.
So thank you so much for your time, Dr. Kochgaway. Are there any future plans that you would like to share with us? Are you planning to take up more hospitals, expand in Calcutta or beyond?
Our our future plan way we work, because again this our organization is mainly owned by doctors. We don't. Can you hear?
Yeah, actually, now I can hear.
Hi.
Yes.
Now it's fine.
Can you repeat it, please?
See, see, our organization is mainly owned by doctors. All of us have been invested, and so we don't want to compete with large corporates. So what we do is our expansion is mainly need based. As we keep on getting more colleagues who want to join us, then we keep on expanding. And even with that, I would say we started with 2 clinics and 1 OT. And now we have 20 consultant rooms with us, 5 OTs, and almost 200 staff. So without just need-based expansion, we have come to this level. So hopefully we'll keep on expanding as more and more people join us. But nothing is planned.
I've heard about your OTs, like they are all steel and very sterile, very well maintained. I've heard stuff like that from patients who recommended you for this interview. So that's really good. So before I leave, I have a small question. I mean, it might be controversial also, but what's the difference between a doctor-owned hospital and a corporate hospital, like that? Is it in facility or is it in attitude?
Attitude wise, it becomes different because see, if it is a doctor owned, we are bound by ethics of medical practice also.
Okay.
And whatever said and done, we cannot cross that boundary. If people do work for profit, and one thing what my elders have taught me, my mentors have taught me, is never run for money. Just keep doing good work. Money is a byproduct of that. That is not the main thing. Your main aim is doing good work. Sometimes that message gets lost. Even I agree. See, being from the fraternity only, but when there is a listed company, so listed company will always look at the bottom line, how much profit it has.
Yes.
We are not fussy about it. We as and when we need whatever instruments, it is not that you cannot do that. The top class equipments, and then also we make profit without running for it. So that is a major difference. Ethically, you are much more correct. Second important thing, suppose if I have poor patients, we all don't hesitate doing it free, doing it thing. If you are in a corporate setup,
Even if the doctor wants to,
paperwork, other things,
I agree with you.
Yeah, they are not able to do.
Yes. So thank you so much, Dr. Kochgaway, for your time.
Thank you.
For the insights into your profession. Thank you so much. It was really beyond the white coat. Thank you so much.
Thank you.